You're with News 5 tonight. Proposed premiums for the new MediShield Life scheme will be announced for several groups next week when the review committee submits its report to the government. The Universal Health Insurance Scheme will cover all Singaporeans for life, including those with pre-existing illnesses. Our reporter has more on how the committee arrived at its recommendations.
After 6 months of consultations with more than 1,000 Singaporeans, the MediShield Life Review Committee has reached the final stage of its review. The 11-member committee met for hours of rigorous discussions before agreeing on the premium levels of MediShield Life. To make this judgment call, they took into account the National Medical Savings Scheme, MediSave.
You look at your average MediSave inflow, then we look at, on average, what is the bill size? Assuming you get into that situation, are you able to afford to pay for your deductibles, pay for your hospital bills from your MediSave? We also did a type of sanity check to look at what is the premium level for a certain age group versus the average income, disposable income, for instance, of that average age group.
No numbers were floated during discussions with the public, but Mr. Chin said the general consensus was that Singaporeans wanted to use their MediSave to pay for their MediShield Life premiums without having to make a cash top-up. And while he felt the majority of Singaporeans will be happy with the committee's recommendations, he noted that not everyone will be satisfied.
We had to manage requests, sometimes a little bit of aggressive demands, I think, from Singaporeans. Like universal coverage, for instance. I mean, there was a segment of people who said that, look, why should we be paying, for people who were not covered before? Singaporeans who have pre-existing conditions coming into the pool, maybe the government should pay for all. Why should we be, paying for the increase in premiums?
When debating MediShield Life enhancements, Mr. Chin said trade-offs had to be made so that the more critical benefits were decided upon first. The committee also took into account how much younger working adults have to pay for premiums and whether to have healthy living incentives such as a no-claim bonus. Following the committee's proposals on June 5th, a final report will be submitted to the Health Minister at the end of June, which will include all the recommendations the committee has had over the past few months. Now, once the report is accepted by the government, a parliamentary debate can be expected before the implementation of MediShield Life in 2015.